So let's start the session of abdomen. In this session, we are going to have just an overview about the abdomen, the abdominal walls, and all the contents that are present in abdomen. And the contents present in the abdomen are different in both males and females. We'll be discussing those contents as well. The abdomen is the lower part of the trunk below the diaphragm. Its walls surround a large cavity called the abdominal cavity. The abdominal cavity is much more extensive than what it appears from outside. It extends upwards deep to costal margin up to the diaphragm and downward within the bony pelvis. Thus, a considerable part of the abdominal cavity is overlapped by the lower part of the thoracic cage above and by the bony pelvis below. The abdominal cavity is subdivided by the plane of pelvic inlet into a larger upper part, that is the abdominal cavity proper, and a smaller lower part called the pelvic cavity. So the plane of pelvic inlet divides the abdominal cavity into large upper part called as the abdominal cavity proper and a smaller lower part called as the pelvic cavity. Clinically, the term abdominal cavity stands for abdominal cavity proper. Abdominal cavity is the largest cavity of the body. Its boundaries and contents are: boundaries. Superiorly, there is diaphragm which separates it from the thoracic cavity. Inferiorly, it's continuous with the pelvic cavity. Anteriorly to the anterior abdominal wall formed by the muscles. Posteriorly to the posterior abdominal wall formed by lumbar vertebrae and muscles. And laterally, lower ribs and parts of the muscles of the anterior abdominal wall. The diaphragm forming the superior boundary moves up and down with respiration. The anterior abdominal wall is firm and elastic. Firmness of the anterior abdominal wall protects the abdominal viscera and its elasticity, allowing the expansion of the abdominal viscera. The posterior abdominal wall is osteomuscular and rigid. Its rigidity provides support to the abdominal organs. So the anterior abdominal wall is firm and elastic. Posterior abdominal wall is osteomuscular and rigid. Contents: the organs and glands of the digestive and urinary systems occupy most of the abdominal cavity. So most of the abdominal cavity is occupied by the contents of the digestive system as well as the urinary system. These organs and glands are stomach, small intestine, most of the large intestine, then liver, gallbladder, pancreas, 2 kidneys, and upper part of the ureters, adrenal glands. Other structures include blood vessels, lymph vessels, nerves, spleen, and lymph nodes. The pelvic cavity is roughly funnel shaped. Remember this. The pelvic cavity is roughly funnel shaped. Boundaries are superiorly continuous with the abdominal cavity at the pelvic inlet, inferiorly to the pelvic diaphragm, posteriorly to the sacrum and coccyx, and anteriorly pubic bones, laterally to the hip bone. The part of the pelvis below the pelvic diaphragm is termed as perineum. Remember that name. Contents: the pelvic cavity contains loop of the small intestine, sigmoid colon, rectum, anal canal, urinary bladder, lower parts of the ureter and urethra. Reproductive organs. What are the reproductive organs present in the pelvic cavity? They are prostate gland, seminal vesicles, vas deferens, ejaculatory duct in males. In case of females, uterus, uterine tubes, ovaries, and vagina. The pelvic and urogenital diaphragms forming the inferior boundary of the pelvic cavity support the pelvic viscera and regulate the act of defecation, micturition, and parturition. Defecation means removal of fecus. Removal of fecus. What is fecus? Fecus is the waste material after digestion. Micturition means urination. And what do you mean by parturition? Parturition means the act of giving birth. So remember this: defecation, removal of fecus, micturition is urination, parturition is the act of giving birth. So the pelvic and the urogenital diaphragms that forms the inferior boundary of the pelvic cavity, they support the pelvic viscera and regulate the acts of defecation, micturition and parturition. The walls of the abdominal cavity and most of the viscera present within it are covered or enclosed by an extensive serous membrane called as the peritoneum. So peritoneum is a serous membrane covering the viscera present in the abdominal cavity. Peritoneum consists of parietal and visceral layers, which are continuous with each other and enclose a potential space called as the peritoneal cavity. All the abdominal viscera are intra-abdominal but extra-peritoneal, except the ovaries in females. So what is peritoneum? Peritoneum is a serous covering. This serous covering that is present around all the organs, all the visceral organs, it has two layers, parietal and visceral layer. Usually visceral layer is the term used to quote the layer that is in close relation to the organ. So visceral layer is the inner layer, whereas parietal layer is the outer layer. And there is a space in between both these layers, and that is called as the peritoneal cavity. Then all the abdominal viscera are intra-abdominal but extra-peritoneal, except for the ovaries in female. Intra-abdominal means the abdominal visceral, the structures that are present in the abdomen, they are within the abdomen, but they are outside the peritoneum, that is extra-peritoneal, except ovaries. The peritoneal cavity is a closed sac in the male, but in female it is an open sac and communicates to the exterior through the openings of the uterine tubes. So you need to understand that in case of males, the peritoneal cavity is a closed sac. There is no opening anywhere. But in case of females, there is an opening in the peritoneal cavity. Where? At the openings of the uterine tubes, that is the fallopian tube. At those openings, there is the communication of the peritoneal cavity to the outside or the exterior parts. The upper part of the abdominal cavity is overlapped by the lower thoracic region and the lower part by the gluteal region. Therefore, the penetrating wounds of these regions frequently involve the abdominal viscera also. The upper abdominal contents such as liver, spleen fill the concavity of the diaphragm. Therefore, it is easy for the surgeons to reach these organs through the thorax and diaphragm or through the anterior abdominal wall. The mobile diaphragm forms the upper boundary or the limit of abdominal cavity. The abdominal contents descend with it on deep inspiration. This is made use of in clinical examination of certain organs such as liver and enlarged spleen, which can be palpated through the anterior abdominal wall inferior to the costal margin on deep inspiration, though they are hidden by the thoracic cage in quiet inspiration. The upper boundary of the abdominal wall is the diaphragm. Diaphragm is mobile. Mobile means it is movable. So the abdominal contents descend downwards with the deep inspiration, because during deep inspiration the concave, that is from the abdominal, according to the abdominal aspect, the concave part of the diaphragm, it gets flattened, so it brings down the abdominal viscera downwards, descending the abdominal viscera. This particular condition is made use in clinical examination of certain organs like the liver and the spleen that has become enlarged, which can be palpated through the anterior abdominal wall during deep inspiration. Okay, so inferior to the costal margins on deep inspiration, we can palpate these organs, but we can only palpate them during deep inspiration because they are hidden by the thoracic cage in quiet inspiration. Perineum is the region at the lower end of the trunk and seem as a diamond shaped area when thighs are abducted. It means when both the thighs are kept apart from each other or spread out from each other. The perineum can be seen at the end of the lower trunk and it is diamond shaped. What are the boundaries? It is an area outlined by the pelvic outlet. Anteriorly there is pubic symphysis, posteriorly there is coccyx, laterally ischiopubic rami anteriorly and sacrotuberous ligaments posteriorly on the lateral part of the perineum. Then the roof is formed by pelvic diaphragm, floor is formed by skin. What are the contents of the perineum? They are external genitalia and anus. External genitalia, in case of males, it is penis and scrotum with its contents in male and vulva in the female. And anus. The abdominal viscera includes stomach, intestine and their associated glands, that is liver and pancreas. Along with that is blood, lymph vessels, spleen, kidney and suprarenal glands. Stomach is the most dilated part of the digestive tube. Stomach is J-shaped and located in the abdominal cavity below the diaphragm, slightly to the left of the midline. The capacity of stomach is 1500 ml or 1.5 liters in males. Function: churning and breaking of food and mixing it with the gastric juice secreted by specialized glands in its mucosa, in the stomach mucosa. Then storing the food temporarily. Secreting intrinsic factor needed for the absorption of vitamin B12. This is a very important function. It secretes, the stomach secretes intrinsic factor that is required for the absorption of vitamin B12. Usually the absorption of the nutrients happens in the intestines, but in case of vitamin B12 it is being absorbed in the stomach itself. The next organ is small intestine. It is a convoluted tube connecting stomach with the large intestine. It is about 6 meters in length. It is very long and extends from the pyloric sphincter to the ileocecal junction. Pyloric sphincter is the area, the opening of the stomach into the small intestine. Okay, so from the pyloric sphincter to the ileocecal junction, there is the small intestine. So where ileum is part of the small intestine and cecum is part of the large intestine. The small intestine is located in the central and lower parts of the abdominal cavity, surrounded by the large intestine. It consists of 3 parts. What are they? Duodenum, jejunum and ileum. The duodenum is proximal short curved C-shaped portion and it is about 25 cm long. Widest most fixed part of the small intestine. Which one? Duodenum. The ducts from gallbladder and liver and pancreas enters the duodenum. Jejunum is the name given to the upper 2/5 of the remainder of the small intestine and the lower 3/5 is termed as the ileum. The main function of the small intestine are digestion of food and absorption of the nutrients. After the small intestine, the next structure is large intestine. It begins at the end of ileum as cecum and terminates at the anus, about 1.5 meter long, whereas the small intestine is 6 meters in length. And the large intestine forms an arch around the coiled up small intestine. For descriptive purpose, it is divided into 7 parts. What are they? Cecum and appendix, ascending colon, transverse colon, descending colon, sigmoid colon, rectum and anal canal. What are the main functions of the large intestine? That is absorption of water and salts and formation and excretion of the feces. Liver is the largest gland of the body. It is located in the upper part of the abdominal cavity, that too in the right side. So it is located in the upper right part. It has 2 main lobes, right and left. The right lobe is much larger than the left lobe. What are the functions of liver? Metabolism of carbohydrates, fat and protein. Detoxification of drugs and poisons. Storage of glycogen, fat soluble vitamins and secretion of the bile. The next organ is gallbladder. It is a pear shaped organ and it is located on the under surface of the right lobe of liver. It receives bile from liver, which it stores and concentrates. When fatty food enters the duodenum, the bile is poured into the intestine through the bile duct by the contraction of the walls of the bladder. Let's understand a clinical condition, jaundice, characterized by the yellowing of skin, sclera of the eyes. So there is yellowness of the skin in an individual who has been affected by jaundice, and along with the yellowness of the skin there is yellowness of the sclera or the white portion that is present in the eye. It occurs when bile enters the blood in liver diseases such as hepatitis or cirrhosis of the liver, where the liver cells break down and release bile into the blood. Bile also enters into the blood when outlet of bile from the gallbladder to the intestine through the bile duct is blocked. So bile enters due to two reasons. One, due to the blockage of the duct. Okay. Second reason is when there is the destruction of the liver cells, which releases the bile into the bloodstream. The next organ is pancreas. Pancreas is an elongated, soft, pale and finely lobulated grey gland. The color of pancreas is grey. It is about 12 to 15 centimeters in length and lies transversely across the posterior abdominal wall. It consists of a broad head, neck, body and a narrow tail. So 4 parts of the pancreas. The head of the gland lies within the curve of the duodenum, the body behind the stomach and the tail in front of the left kidney. The tail extends as far as the spleen. Functions: pancreas is a exoendocrine gland. So it is a gland that releases enzymes as well as hormones. That is why it is called as exoendocrine glands. An exocrine gland is a gland that releases enzymes, and endocrine gland is a gland that releases hormones. So pancreas is an exoendocrine gland. The function of exocrine pancreas is to produce pancreatic juice containing enzymes that digest carbs, proteins and fats. Function of endocrine pancreas is to secrete hormones such as insulin and glucagon, which control the blood glucose level. A clinical condition related to pancreas, which is very common, some member of your family might have this, that is diabetes mellitus. It is the result due to deficiency of insulin, resulting in diabetes mellitus. Blood sugar level rises above the renal threshold and glucose is lost in the urine. The next organ is spleen. Spleen is a large wedge-shaped mass of vascular and lymphoid tissue. So the whole organ of spleen is formed by the vascular tissue as well as lymphoid tissue. It is purplish red in color and lies high up to the back of the abdominal cavity on the left side behind the stomach. Its functions are destruction of red blood cells and production of fresh lymphocytes for the bloodstream. The next organ is kidneys. They are two bean-shaped organs situated on the posterior abdominal wall, one on each side of the vertebral column, behind the peritoneum. Right kidney usually lies a slightly lower level than the left. What is the function? Secrete and excrete urine. The composition of blood must not vary beyond certain limits if the tissues of the body are to remain healthy. This regulation depends on the removal of harmful waste products and maintenance of water and electrolyte balance. Ureter, they are two tubes which connect the kidneys to the bladder. Each ureter is around 25 centimeters long and diameter is 3 millimeter. Function is to transport the urine that is formed in the kidney from the kidneys to the urinary bladder. Next gland is adrenal glands or suprarenal glands. Suprarenal, so from the name itself we can understand its location. It is present above the kidneys. Suprarenal means kidneys. There are two suprarenal glands, right and left. Okay, each gland caps the upper pole of the corresponding kidney. The right gland is triangular, whereas the left gland is semilunar in shape. Each gland consists of two parts, cortex, medulla. Function of cortex is to secrete a number of steroid hormones which are responsible for the maintenance of electrolyte and water balance, maintenance of blood sugar concentration, liver and muscle glycogen, and control of the inflammatory reactions. So it gives off hormones in order to regulate many important functions like the maintenance of the water and the electrolyte balance, then maintenance of blood sugar concentration, and as well as the glycogen that is stored in the liver and muscles, maintenance of that as well, then control of inflammatory reactions. So these are the functions of the cortex of the suprarenal or adrenal glands. The function of medulla is to secrete adrenaline and noradrenaline in the blood, which serve as neurotransmitters. So we have learned about the viscera that are present in the abdominal cavity proper. Now let's understand the pelvic viscera. They are different in both males and female. In males, there is urinary bladder, prostate and rectum, whereas in females there is urinary bladder, uterus and rectum. So the urinary bladder is a reservoir of urine. Its size, shape and position vary, or it could differ with the amount of urine it contains. When empty, it lies in the pelvic cavity, but when distended with urine, it expands upward and forward into the abdominal cavity. Bladder can hold around 500 ml or close to 600 ml, that is half a liter of urine, though this would cause pain. The desire to empty the bladder is normally felt when it contains around 250 to 300 ml of urine. So when the bladder contains around 250 to 300 ml, we feel to go and urinate. But if we don't urinate, the bladder will still keep on collecting the urine and it can collect a maximum of 500 ml. At that time, there will be pain causing in the bladder. The two ureters enter into it through the posterior wall. The urethra leaves the bladder at the neck. The neck of the bladder is lowest and most fixed part of the urinary bladder. A thickening of smooth muscle called internal urethral sphincter surrounds the opening of the urethra. Function: stores urine and expels it into the urethra. The urethra is a narrow canal that extends from the internal urethral orifice in the urinary bladder to the external urethral orifice. In males, urethra is about 18 to 20 centimeters long, whereas in females it is about 4 centimeters long. Functions: in a male, the urethra serves as a common passage for both semen and urine, whereas in female, urethra discharges urine from the body. The next gland in the pelvic cavity in males is prostate gland. It is a fibro-musculo-glandular organ which surrounds the commencement of the urethra in male. It is situated in the pelvic cavity behind the pubic symphysis and in front of the rectum. It is about the size of a chestnut and is traversed by the urethra and ejaculatory ducts. The function of prostate is to secrete a thin milky fluid which forms 30% of the semen, and it gives the milky appearance of the semen. The prostatic secretion is alkaline in nature and provides nourishment to the sperms. That is the main function, to secrete a thin milky fluid which constitute about the 30% of the semen. The main function of this fluid is to nourish the sperm cells. The next organ is seminal vesicles. Seminal vesicles are two small fibromuscular pouches lying between the base of the bladder and the rectum. The seminal vesicles secrete alkaline fluid containing nutrients for sperms and forms about 60% of the seminal fluid. The next organ is ejaculatory ducts. They are two narrow tubes about 1 centimeter long, and the duct of the seminal vesicle, ductus deferens, unite together to form the ejaculatory ducts. They traverse the prostate gland to open into the urethra within the gland. Function: ejaculatory duct expels the secretion of testis and seminal vesicles into the prostatic urethra. Let's understand the organs that are present in the pelvic cavity of the females. The first organ is uterus. It is a hollow, thick-walled and muscular organ situated in the pelvic cavity between the urinary bladder and the rectum. It is pear-shaped, flattened anterior-posteriorly. We have also studied about another pear-shaped organ, that is gallbladder. In the majority of women, the uterus leans forward. That is position is called as anteflexion. Bends forward. That position is called as anteversion. Almost at a right angle to the vagina. So the normal position is anteflexion, that is leaning forward, and bending forward, that is anteversion. So normal position of uterus is anteflexion and anteversion. In erect posture, uterus lies in an almost horizontal position. The uterus is divided from above downwards into three parts. Fundus is the uppermost part, below that is the body and cervix. The cervix protrudes into the vagina through its anterior wall and opens into it at the external os. Above on either side, it communicates with the uterine tubes which open into it. Below it communicates with the vagina. So above the uterus, it connects with the uterine tubes or the fallopian tubes, and below there is a connection to the vagina. What are the functions of uterus after puberty? Responsible for menstrual cycle, provides implantation to zygote in its wall. If there is fertilization, then it provides the implantation of the zygote. Then allows growth and development of the embryo and fetus. Vagina, it is a fibromuscular tube which extends obliquely downwards and forwards from the uterus to the vestibule of the vagina. Vestibule of the vagina is the space that is present between the labia. Labia is an external reproductive organ in females. So the space between the labia is the vestibule of vagina, and that space is elliptical in shape. It is situated between the urinary bladder in front and rectum and anal canal behind. The vagina has no secretory glands, though it is kept moist by the cervical secretions. Functions of vagina: acts as a receptacle for penis during coitus, provides an elastic passage to the baby during childbirth. The next structure are uterine tubes. There are two uterine tubes. Each tube is about 10 cm long. Uterine tubes is also called as fallopian tube. The uterine tube extends from the side of the uterus between the fundus and the body to the ovary, where it opens into the peritoneal cavity. It is divided into the following parts from distal to the proximal end, that is infundibulum, ampulla, isthmus and intramural parts. The functions of the uterine tube: transport the ovum from ovary to its lumen and provides an ideal site for fertilization. So fertilization usually occurs in the fallopian tube or the uterine tube. Transport the fertilized ovum to the uterine cavity for implantation. Okay, so the next organ is ovaries. Ovaries are female gonads. Each ovary is about the size and shape of an almond, and it is situated in a shallow fossa on the lateral wall of the pelvic cavity, behind and below the distal end of the uterine tube. What are the functions of ovaries? Begin to function at puberty and continue to discharge ova at monthly intervals from about the age of 13 years to about the age of 45 years. In order to understand the different organs, the location of the different organs in the abdomen is divided into different regions by the clinicians. Okay, it is divided into 9 regions basically. Okay, this facilitates the description position of organs present in the abdominal cavity during clinical examination. The 9 regions are right hypochondriac region, left hypochondriac region, then right lumbar region, left lumbar region, right iliac fossa, left iliac fossa. These are the areas on either side of the abdomen. Then the regions in the central part of the abdomen, that is epigastric, umbilical and hypogastric region. Disorders of the abdomen. The disorders of the abdomen and pelvis are numerous. The important ones are, first is hernia and abdominal pain. Hernia is a protrusion of the organ through the wall which contains or retains it. The common abdominal hernias are inguinal hernia, umbilical hernia, femoral hernia and incisional hernia. Next disorder of the abdomen is abdominal pain. Many intra-abdominal diseases present with pain only. The two important features of the abdominal pain are its site and its nature. If a clinician knows about these features, he or she has a good chance of making a correct diagnosis. In general, the upper abdominal pain mostly occurs due to the involvement of gallbladder, stomach, duodenum and pancreas. Okay. The central abdominal pain usually occurs due to the involvement of small bowel and kidneys. Lower abdominal pain occurs due to the involvement of urinary bladder, uterus, cecum and sigmoid colon. So remember that upper abdominal pain is usually due to the involvement of gallbladder or stomach or duodenum or pancreas. Central area due to small bowel, that is small intestine and kidneys, and the lower abdominal pain due to the involvement of urinary bladder or uterus in case of females, cecum and sigmoid colon. The next disturbance is the abdominal mass. Common causes are hepatomegaly, that is enlargement of the liver, splenomegaly, enlargement of the spleen, hydronephrosis, enlargement of the kidney. That enlargement is due to the accumulation of water. Then pseudocyst of pancreas, that is also an enlargement. Then mesenteric cyst, carcinoma of an stomach and enlargement of gallbladder. Then accumulation of fecus as well. In certain constipated patients, there is accumulation of fecus which could also form an abdominal mass. Then retention of urine in urinary bladder, ovarian cyst, pregnant uterus, uterine fibroids and appendicular mass. Then the next condition is abdominal distension. The 6 common causes of abdominal distension are fetus, flatus, fecus, fat, fluid and fibroid. So fetus is a normal condition after pregnancy. Okay, flatus could be normal or pathological. Okay, fecus is a normal condition, that is an impaction of feces in bowels. Then fat, it is normal in beginning, but if the fat increases, it becomes obese and it becomes a pathological condition. Then fluid, this is a pathological condition always, that is ascites. And fibroid, this is also a pathological condition, a diseased condition. The name of 6 conditions that cause abdominal distension start with the letter F. The distension is normal in infants and young children due to the following reasons. Their gastrointestinal tract contains a considerable amount of air. That is why in fetus and children there is distension. The next reason is the liver is relatively large in size. Their abdominal muscles are relatively less toned.